Okay, thanks a lot. ECG interval estimation and diagnosis is the challenge topic of this year. So ICBV provide a good data sources for us, for our researchers to do the good research on this field. So now I just want to share my work to all of you. First, I'm Chai-Min Chen from Taiwan. First, we take a look about the challenge target. The challenge target of this year is about two steps. The first step is to do the classification for reason types. The reason type was classified into three classes. One is non-AF. AF means the atrial fibrillation is a kind of the arrhythmia, and the second one is persistent AF reason, and another one is paroxysmal AF reason. So the classification you can see in the left side, the scoring matrix is not equal. It's a weighted scoring matrix because some of the situation we believe is more important to take into consideration. The most important, the severe part is about if a guy who has a disease but eventually not detected, it will be very severe situation. So you can see in the left column, if the answer is about AFP or FF, that they will, but your prediction is about this is normal. So you will give a -2 or -1. Okay. The second step is about the interval estimation for any AF episode. That's about once you classify the patient into these three kind of type, now you will need to take a look about which intervals of the abnormal region. So for example, you have an ECG record in 30 seconds, maybe only 20 seconds is abnormal and the rest of them are normal. So you have to mark the abnormal region for them to do the interval estimation. And the final score of this competition will be weighted by combining the results step 1 and step 2. The scoring function is below the U blah blah blah, something like this, so we can gather a score here. Anyway, we take a look about the challenge data. First, we have already known about the challenge target. The second part is to know what we have, what do we have, what the conference provides us. So we find out the conference provides us about the training set, about the first stage and the second stage training set. The first stage and the second stage training set are delivered in a different date. So we don't know the data distribution will be as the same to any of them or just totally different in the test sets. You can see the left column sources, the test set, the different source maybe. So we don't know the distribution of this training data. So you can see the difficulty of this is about very imbalanced. We don't know the distribution, and this is limited to 1 and 2, 1 lead and 2 lead, and the length is variable. The total record and total records only 700 around. So, and another important part is they mentioned that some FF event might be removed because no less than 5 heartbeat F event will be removed. This is this diagnostic criteria for doctors. Yeah. And the difficulty I just mentioned, first is variable length. So AI can be trained due to limited resources, and because some records is about 6.8 hours. The minimum is about 8 to 8.3 seconds. So the difference of this data time and recording time is very different. Yeah. And the second part is imbalanced levels. The AI might be prone to predict major levels, just as I mentioned. You can see non-AF patient 39 here, and AF patient 5, AFP 5. So if you, the normal sense, the common sense will tell you that the classification model may predict, maybe prone to predict non-AF patients. Yeah. And the third difficulty is about just the criteria that less than 5 heartbeat F and N event will be removed. So AI might confuse in interval estimation, even though they believe this interval has something wrong, but eventually it was removed. So they will it's confusing, yeah. And the fourth part is the ambiguous separation of AFF and AFP. AFF is persistent arrhythmia fibrillation. The AFP is a paroxysmal atrial fibrillation. The, the difference of these two is AFF, you got a full F abnormality during the whole recording time. The AFP means only have some intervals that have the abnormal abnormal disease, atrial fibrillation. So, you know, single misjudgment of the AF event may lead to the AFP misjudged into the AF. So now we got the strategies to tackle this first main difficulty. Yeah. About the variable length, we just use the limited size of recording time for training. Yeah. And the second imbalance level, we use the F event level instead of the NF and FP. Yeah. The third part is we use the post-processing to adjust the interval estimation. Yeah, just post-processing. The fourth part is use AF events overall percentage to judge. About the first strategy, the variable length, AI can be trained due to limited resources. Because we use limited size of recording time for training, this time we use about 0.8 seconds per segment. That because we put all of the recording in divided into segments, and use this segment to train a classification model. Yeah. And finally we overlap the continuous segment. Uh, each for example, you've got a T1 and T2 they've got an overlapping about half of them. So which means 0.4 seconds will be overlapped. So they will ensure that all of the data information will be used in this classification model. Okay. About the second imbalance labeled issued, the AI might be prone to predict major labels. So we don't do the direct classification of the patient. We first infer the AF event intervals. So we can see if this is a patient, the ECG records of one patient. This patient got one AF event in middle. So since we put this ECG record into segments, the sum of the segments will be counted as with AF event, just like a left bottom side boxes. The sum of the AF event will be classified as without AF event, just like the right bottom one. Yeah. So we train a classifier for AF events. There is the AF event or not, just 1 and 0 classification, and use this window classification to do the whole prediction, and you will get the F high possibility regions. The third part is about the post processing, about the 5 heartbeats F and N events are removed. So we do the same post processing. First, we use the model to infer the whole length of the ECG records, and then we use the post processing criteria, which are N events lasting smaller than 6.4 seconds. That I will remove it. If the AF events lasting smaller than 1.6 seconds, that will also be removed. So after this processing, the they will quite meet into the less than 5 heartbeats F and N event removed criteria to improve. About the fourth difficulty is ambiguous separation of AFF and AFP. But first, to count the length of the all AF events we predicted, and then divide it by the whole length of the records, So you will get the percentage from 0 to 100 percentage, right? And if the one who got the higher AF event percentage higher than 95%, that will be classified as AFF. I believe it will be full length of the arrhythmia fibrillation, so I believe it was persistent AFF. Then, as the one who got less than 5% AFF event, I will consider it as a normal because some of the event might be misjudged. Now, this is the overall workflow here. You can see the left side, there's a CPSC 2018 data. Because this kind of the model we use are the same into the CPSC challenge-based the challenge model. Yeah, but we use that model and the data to train the pre-trained arrhythmia classifier, and use that classifier transferred into with our CPSC 2021 data, and then we train another AF classifier, then use this classifier to predict the interval, and finally we use a post-processing to make our final interval estimations. That's all about my work of this challenge, and very welcome everyone to come to our city, which is a research center for innovation and information technology innovations. Thanks for everyone's listening.